mission to protect our communities from COVID-19. We have been doing this for several weeks. We've made hundreds of thousands of robocalls directly to people living in these communities. We've handed out tens of thousands of masks, thousands of pamphlets with information about how one can protect themselves as well as their neighborhoods. Hundreds of calls, including to local doctors and other clinicians, to enlist them as partners in this important effort. Dozens of community meetings that I and Dr. Katz and many others have participated in. But today I want to be very clear. This may be the most precarious moment that we're facing since we have emerged from lockdown. The letter that we sent out yesterday outlined some actions that will take place in the days ahead. We will move as swiftly as the situation warrants. Right now, I want to ensure that our spirit, the spirit of our message, is that we are in service to our community, that we try to protect our families and our loved ones. We know, sadly, from personal experience earlier this year, that COVID-19 presents the greatest risk to our elders, to the people who are most vulnerable in our communities, people who suffer from chronic illnesses. We must help those most in need. The prescription is to follow what we call the Core 4. Avoid large gatherings, especially indoors, wear a face covering, keep the social distance, and stay 6 feet apart. If we don't follow public health guidance, this virus will potentially evolve into wider community spread. We can deliver these messages, we can continue to have the conversations, but this takes a group response. By following these public health rules, you're not just helping yourselves, you're helping your parents, your children, grandparents, and neighbors as well. Thank you so much. And next to speak to all of you is Dr. Ted Long, who serves as the Executive Director of the Test and Trace Corps. Thank you.
Again, ladies and gentlemen, this is the biggest liar of them all.
Tell you what.
Show us some numbers, at least numbers, because I have a lot of people tested, and I've been to the hospital every day, and I've been tested 3 times.
Let it finish.
And I'm 6 feet away. I've been tested, and I've seen people in the hospital being tested positive, and 2 hours later negative. We had a 24-hour test for the correct test. So I want to see numbers of anybody in this community, because I go to the hospital every morning.
Okay.
There's 1 case in the last 6 weeks. You must show us any numbers to these guys, because that other doctor lied. This community, since it's opened up, has less problems. Your numbers are false. You're fining us. How many issues of fines has the Department of Health issued? In the tens of millions. You're just punishing this community because we can vote. And I have no problem. But I want to ask you a question. Where are our councilmen, our assemblymen, our state senators? Nobody's here to support you because you're a liar. Not you yourself, your agency and your mayor. And this has to, excuse me.
It's okay, it's okay.
I'm talking to him.
Put your mask
And that's
on.
it.
Please allow him to speak.
Your Black Lives Matter liar.
Oh, that would be
This
great.
community
Okay, here we
has
go.
not-
All right.
has not
Let him finish. Let him
I'm going
finish.
to finish my question.
And then he'll let me
You will
talk.
answer, and I will be quiet.
not
That's
here
all I
to
ask.
listen.
It is before Yom Kippur.
Yeah, just put your mask on and you can
Yes,
finish.
man, Rosh Hashanah.
You could have done your press
period of
conference.
atonement.
You could have done your press conference Monday or yesterday. You waited for the opportunity when nobody
another
could
mask.
get you. You waited for the opportunity.
That's
Why today? And I want last question. Please take out a piece of paper and show me numbers of kids, people my age, besides the senior citizens. And one last part of it.
Yeah.
I want to know about the heart attacks, the cancers, and the pneumonia deaths, which you have not reported. Because every death you report, I have my documents. I go to the hospital. I have Atzola giving me printouts. My desk is piled just like yours. None of those numbers have come out to the media. When you show us those numbers, maybe we'll believe you.
Okay.
Go ahead, all yours.
I've let you speak.
Yes, you will. I will
And
now be quiet.
Thank you, sir.
Thank you.
Okay.
So to introduce myself, I'm Dr. Long. I'm a primary care doctor. I see patients in the Bronx, and I'm here today. Makes me think about when this all started back in March. I remember when we started to hear about coronavirus in March, I was seeing patients in my clinic as I do every week, and two of the staff members in my clinic, two people I care about, came back with positive tests. So we then brought all of our staff together, and this is before we really knew what was going to happen with coronavirus. We brought our staff together, and I looked around the room, and everybody had the same look on their face. How serious really is this? How bad is this going to get? We all know what happened next, though. In March and April of this year were two of the worst months in our country's history. We lost tens of thousands of New Yorkers. It was one of the scariest times of my life, and it was one of the worst times of many people in New York's lives. We cannot let that happen again. Now, I want to directly address the question of why are we here today, and what does the data show? I'm going to give you a very clear data point. Where we stand here physically today, there are 3 times as many cases, new cases every day of coronavirus. If that was not the case, 3 times as many here on this pavement where we stand today, we would not be here today. We are here because 3 times the number of new cases every day is extremely concerning. But there is good news. We can help. In New York City, as you know, we have one of the lowest rates of coronavirus of any big city in the whole country. One of the ways we've been able to do that is through testing and tracing people, so we can figure out how we can get them to isolate and not transmit the virus to others, and how we can figure out who they may have exposed to the virus so that we can give them help too. Since starting the Test and Trace Corps in June, we've driven down across New York City the number of new cases every single day by 2/3. We can do the same thing here to address the fact that there's a 3-fold increase, but we can't do it alone. Across New York City today, we're able to reach 90% of new cases of coronavirus, and for nearly 80% of them, we're able to complete interviews, get them to isolate, figure out how we can help them, and ask them who they may have exposed so that we can reach out to them and keep them safe as well. In the communities that are seeing an uptick now, more data. We're seeing right now in those communities a 3-fold increase in 2 other communities as well. That's why we're concerned. And what I want to do is we've identified 2,000 cases and 3,000 contacts. I want them all to be a part of our program because we know our program works. It has worked in the biggest city in the country. It will work here. But it won't work if we don't all work together. So I want to ask for your help in terms of making this work, getting people to participate, getting people to isolate if they're a positive case, getting people to share with us who they may have exposed so we can do our work. We want to do the work for you. The other thing we want to do to help you too, and we've been in touch with local rabbis, you've seen us around the last few days, we're handing out now more than 200,000 masks. Look around. We're handing out, oh, thank you for joining us today. Exactly. We're handing out masks to everybody, including us, people in school. Everybody should wear a mask. That's singularly such an important thing that we can do. And we're now, I'm going to tell you, more than 300 synagogues across New York City, we're arming them with masks to help. So that when you go to celebrate Rosh Hashanah or Yom Kippur, we want you to be able to put on a mask and wear the mask in your synagogue. We want to do that to help. But it's important to say, we are here today to tell you we're worried and to give you our firm offer to help. If there is anything humanly possible that we can do to help you more than what we're already doing, don't keep it a secret. Tell us today. I'm happy to even stay after here. We want to know what we can do to help. And between handing out hundreds of thousands of masks, creating a program where we can really keep people safe, giving them resources to stay at home, we'll do anything in our power to help you. Help us to help you. I am here to help. Thank you.
Hold on, Doctor, wait. One question. You do understand that 40% of your test results are incorrect. Number 1, fact, because you didn't read documentation, I'm going to tell you. 2, you're telling us that we've gone up and triple your uptake. My question to you is, if you come to any of my 2 hospitals in the neighborhood, there's 1 corona patient. So with your uptick, where are all these people? And finally, I don't know, maybe they're home, maybe we're hiding them somewhere in the basement, so you don't see them. But I haven't seen them. And third of all, where is all your test results? You and I know that 50% or 40% of your test results are wrong. So your uptick, number Mr. Wolf, how come I don't see you have testing booths all over? Instead, all you have is your violent Nazi stormtroopers coming in here. I will say what I want,
All right, so-
and they're coming in to violate us, and issues. That's what you're here for.
right.
But that's it. I have
No, no, no. Let me. I'm
I'm
gonna.
done. After this, I'm done.
But wear your mask up.
I agree with all of you. I agree with everything you say, Donovan. Everything you say. My question is, yesterday, I was watching the news, and I saw the great leader, Governor Trump, tell the citizens and the state citizens that there's a vaccine that is coming out, and he will not allow us to use it.
You don't live here. Show me your address. Show me your
Okay. So everybody. Hang on.
Get out of
Why are
here.
you not
Get out of here.
Okay. I listen for everybody.
Get the fuck out of here.
For everybody,
You're paying your paycheck. Get out of here. You're taxes to pay my paycheck. Get out of here.
I listen very intently.
Go to your fucking nice house someplace.
I'd like to answer the question.
I don't want to
We are watching the health officials discuss an uptick in neighborhoods in Brooklyn and Queens, but right now there are some members from the community who are very upset. They do not believe the numbers, and they are questioning the health officials. And there are people who are there at this press conference who would like these men to put on masks, and obviously they have not yet. So let's listen in, and we'll see where we're going to take this.
I'm going to give quick answers to his 3 questions, as I promised. Then I'm going to allow Dr. Varma to speak, and then we're going to listen, and then we're going to let everybody ask questions. Okay?
Go back to your own right, you stupid mayor, and wear your
Hang on.
mask. Where's the mask for that?
You asked me 3 questions. Now I have to remember all 3.
Sorry.
Okay. Your first question was.
Sir, you're in our way. Come on. Please.
Okay. Your first question was, are we seeing an uptick in the number of people going to the hospital? So thankfully, we've not seen the same uptick yet that we did when coronavirus hit in March and April. That means we have time to act now. We're here today because if we do, you said you agreed with me, if we do everything I said, the virus would be suppressed in this community fairly quickly. We can do this together. The second question is, where are the troops we're bringing in and all that stuff? We're bringing in 12 new mobile units, just like this one, on Tuesday this coming week. And your third question was vaccine. We are going to make the vaccine, I mean, to the extent to which it's under our purview, we're going to make it equitably available to everybody as soon as humanly possible.
Governor said no.
Hesse, we don't
I-
take questions. You can't have
I
all
will,
the questions.
I will, but this is my community. Your
Okay.
questions come after
All
my
right.
community.
So I'm going to pass it to Dr. Varma now.
This will be done. We're pulling this. Thank you.
Thank God. Doc, thank you. You can always call me. I'm willing to help you guys out.
Sorry, guys.
Thank you.
Hesse,
Can we just ask one question for the media while you're here?
You gotta be ready.
Excuse me, sir, can we just ask one question, please? Stand off to the left.
You will not scream at me.
Okay, you are watching the press conference that is happening in the Grace End Park in Brooklyn. They're talking about the uptick in cases there, but there are members of the community who are not happy. They're wondering why they're not seeing an increase in the number of people going to the hospitals in that area with COVID-19. Dr. Ted Long, very patient. He's with the Test and Trace Corporation, and he was explaining if we can get this under control right now, we will not see that uptick in the hospitalizations that we saw in, say, March and April. He talked about the 12 mobile units that they'll be bringing into the neighborhoods that are affected. There are about 3 neighborhoods in particular that they're worried about that have seen triple the number of positive cases in recent days, and that's what they want to get a handle on. They're asking the community to work with them, and we will see where that goes. But right now, there's a lot of questions because members of the community were there. They were angry. They were not wearing masks, and health officials decided to stop the news conference. We will have much more for you as we go through the day. But again, an uptick in certain neighborhoods, 3 times as many new cases. They're concerned about it. They're bringing in new mobile units, 12 of them, and hoping to not see an uptick in the hospitalizations in the coming weeks.